Good afternoon. I'm Kevin Ermacher, the Deputy News Applications Editor at ProPublica, and I'm your host for today's presentation. We're so glad you could join us for this conversation about our new RX Inspector news app. We'll wait a minute or so for a few people to join, and then we'll get started. While we wait, I'm going to go over some housekeeping items. A quick note that this event is being recorded, and a link to the video will be emailed to everyone who registered. Closed captioning is available for today's session. To access that, hover your mouse over the presenter window and you'll see a gray menu bar along the bottom of that window. Click on English CC to turn captions on. If you have any trouble accessing that, just let us know in the Q&A and we'll do our best to help. I'd also like to note that we've turned off the chat display for today's event. We had so many folks register and we didn't want the chat to become distracting. Finally, you can access a few key resources by clicking on the resources icon on the bar to the right of your screen. Included in our list of resources are links to the reporting and our tips page. Okay, it looks like we have gathered enough people to get started. More than a year ago, ProPublica journalists embarked on an investigation into the safety of America's generic drugs, which make up about 90% of prescriptions dispensed in the US. Our series details how a secret group inside the Food and Drug Administration allowed generic drugs made in dangerous and dirty factories to be sold to unsuspecting Americans, ostensibly to prevent drug shortages. Other stories found additional failures to protect the public from unsafe or ineffective medication. The stories were grounded by public records obtained through about 40 Freedom of Information requests filed over the course of a year. When the FDA refused to quickly release the documents, ProPublica sued the agency and won. The FDA was forced to release information that had never before been made public, including factory location information and records that would identify drugs made at some of the most troubled factories in India. The FDA also released to us thousands of pages of inspection reports for foreign factories. That information was instrumental in the creation of ProPublica's RX Inspector, our new interactive tool that provides answers to what the FDA won't tell us, where generic drugs are coming from, and the track records of the factories that make them. RX Inspector provides consumers, researchers, journalists, and doctors the most detailed look to date at the makers of America's generic drugs and whether they've met manufacturing standards meant to keep us safe. We built this tool to empower consumers to have more informed conversations with their healthcare providers about the drugs they are prescribed. Just to note at the top, ProPublica does not provide medical advice. Keep in mind that if you turn up a troubling inspection report, it doesn't necessarily mean that your drug is compromised. Doctors and pharmacists have advised that you do not stop taking your medications. Instead, you should talk with your healthcare provider about any concerns. I'd now like to hand this session over to my colleagues, Ruth Talbot and Brandon Roberts. They're news applications developers here at ProPublica who built the RX Inspector. Ruth and Brandon will be talking to you about how to use the app and what kind of information you can find in it. Ruth, you take it away.
Hey everyone. So I hope you can all see my screen. Drop in the chat if you can't. But I'm going to kick us off by talking through one of the more common use cases for the app, which is just looking up an individual drug, maybe one that you have that you're taking or someone you know is taking. So we're going to start off with this example. This is actually a drug that I dug out of my medicine cabinet. It's an antibiotic called cephalexin. I hope I'm pronouncing that right. And I've highlighted some of the kind of important information that I looked at to find this in our app, and also information that you should look for if you are trying to do the same thing. So first is the name. Second is the dose, which you can see it says 500 milligrams. Third is the form, so it's a capsule, it's a pill. And then on the back, there's some information that was a lot smaller on my bottle, but that is also very critical. There's what appears to be a company name, so it says Lupin Pharmaceutical. And then there's a description of the pill that's inside the bottle. So I don't know how clear it is for people following along, so I'll just read it out loud. It says, "This is a light green, dark green, oblong-shaped capsule imprinted with 500, 500 on one side and lupin, lupin on the other side." So all of that is going to be really helpful in getting us to narrow down to the drug in the app and really feel confident that we have the right one. Um, so now I'm going to begin my search, and it's going to be a live demo, and I was having slight internet problems right before this, so bear with me. Hopefully it all goes smoothly. So this is the home page of the app where you would land and start your journey. There are some advanced search options below, including the ability to search by facility, which I think Brandon is going to touch on later. But we are going to start by just clicking this button, which is where most people will probably start. And it takes you to kind of a guided search experience. So the first step, it says here, we already did that, just gathering your information. And I showed everyone a pill bottle. That was what I had. But this can be anything you have, from the container it came in to the pills or the drug itself, and any packaging that the drug came with. All of that could come in handy in finding your drug. So just gather whatever you have. And the second step is searching for your drug. So I had the drug name and the company name as well, but I'm actually gonna just stop here and highlight this really quickly. This is searching by something called National Drug Code. And I did not have this in this example that I'm showing, but I just wanted to highlight it because if you do have a national drug code, which is just a series of numbers separated by some hyphens, that is a unique identifier for your drug. And so that can be really, really useful in finding your drug. So just an example here, it looks like this. If you plug it in, it should basically pop you to one drug. It should make finding your drug really easy. However, there's no guarantees that you have that, and I didn't in this case. So the second option would be go down here and type in the name of your drug. And I did see a company name on my bottle, but I'm just going to pretend I didn't for now, just to show everyone what it looks like when there's a decent number of search results coming back. Great. So this is a search results page. You can see we had well over 100 options returned. And I'm going to zoom on one of these in case it's a little hard to see on the screen. This is a specific drug result. You'll see a lot of information here, including that drug code I just mentioned, a company name, the dose, in this case 250 milligrams. And you'll also see a description of the drug. In this case, it's a pill. It'll have things like color, flavor, shape, and then also really helpful for pills specifically, it could have markings. This is numbers or letters that appear on the pill, and these can be very specific to certain pills, so it could really help narrow the results if your pill does have something like that. Given that I had a lot of results here, I might turn to the filters, which let you kind of filter down on a lot of those key values we just talked about. So for instance, if I have cephalexin and I know it's in a powder form, that's an option. I can go here, filter down by powder, and then suddenly I'm down to 6 results, and it's a lot easier to page through those. And then, like I said, there's also markings can be really, really helpful. So if you look at your pill, you read that text on your pill. Maybe mine says 2238 Teva. I click on that. We're down to one result. So it's really good to kind of play around with those to try to narrow the field a little. In this specific case, though, I know that mine said Lupin Pharmaceutical, so I'm going to go in and type that in. And that really quickly gets us down to these drugs. Looking at that, I remember mine was 500 milligrams. It was a green capsule. And this actually really matches very closely that description on my bottle. So I feel pretty confident that this is my drug. Yeah, so then once you've gotten here, this is a drug page. It has a little more information about the drug, including a link to a site called DailyMed, which has pictures of packaging of the drug, and some other information. Just if you're still not sure it's your drug, this can be a good place to land and try to double check that. I'm pretty sure it's my drug, so I'm going to focus on the manufacturing information available to me. So this is a pretty straightforward example. There's one manufacturing facility. The company name here looks pretty similar to the company name of the drug or on the drug on the bottle. Not every result you see is going to be this straightforward. Um, there can be a few different things that aren't visible here. For one, the company on the facility might not be the company on your label. That's okay. Sometimes different companies manufacture drugs that are then labeled by other companies, so it's okay if they don't match. And then the other thing is that I only got one manufacturing facility result. You may not see any results. That just means that we weren't with high confidence able to match your drug to a facility. You may also see more than one result here, and that can be for several reasons. One could be that our data indicated several possible facilities the drug was manufactured in, and the other could be that there were several facilities that played different roles in the manufacture of the drug. So, for instance, some facilities manufacture ingredients that are then taken by other facilities and used to manufacture the drug itself. So those are the kind of the reasons you might see not just one manufacturing facility. But like I said, this is a great example, very straightforward, and there's just one facility listed that we believe played a role in manufacturing the drug. And real quick, before I click through, I just want to highlight some kind of summary information that we make available so that you can scan and just get a sense of what may or may not be going on at the facility. We have the location. We have the last FDA action, which is basically the last time the FDA issued something that we have related to this facility, and Brandon will sort of get into the weeds of what those possible actions are and what they mean in just a second. And then the last thing we have here, which you will not see on every facility, is a flag for recent compliance action. And this basically means that sometime in the last 5 years, the FDA flagged issues at this facility that they want fixed. And again, Brandon's going to get into exactly what those possible outcomes are and what they mean. So then you can click through, just click on view details, and you'll land on a facility page. And I'm going to turn it over to Brandon, who's going to talk us through what you might see on a facility page and what that means.
Thanks, Ruth. Yeah, Brandon Roberts, news apps developer here. And yeah, we are on a facility page. So if you got here, you're looking at a facility that likely produced the medication you're looking at. And at the top, you'll see some summary information. So you'll see the name of the facility, and then the other things that Ruth just discussed, the last action and the compliance, the recent compliance. Below, we have some basic counts about inspections, and we have some basic information about how the FDA inspects facilities. The thing I want to point out here is these little location pin, and it says India, so this facility is in India. But if you click on the See Location Details and go to the next slide, you will see the full address. So it's a very long address. That's where this facility is. And then to the right of that, we have the FDA Establishment Identifier, AKA the FEI number. And that number is how FDA frequently refers to this facility in its other data sets. So you'll see this in public inspections data, citations, warning letters, 483s, if that's a bunch of terminology you don't know. Debbie and Megan will talk more about that. And then, yeah, there's like this red exclamation point recent compliance action that Ruth just talked about. That means that, the facility had some deficiencies in the last 5 years that the FDA wants fixed. So if you click on that read more, it'll take you down to the facility history. Next slide. Before we talk about the history, we want to talk about the types of outcomes that a facility can have when it comes to FDA inspections. The first one is the left here, this gray minus mark. This is where the FDA did an inspection and determined that this facility was in an acceptable state. That's the most common outcome that we've seen in our data. The next one is this yellow exclamation point. This means that there was an inspection and the FDA decided that they could voluntarily fix the issues, meaning that the FDA didn't need to mandate specific fixes, or that we don't have information about the inspection, but we do have an investigator's report. And this is because the FDA does not publish information about all of its inspections. Certain types it withholds. So in some cases, we'll only have like a little glimpse into what the inspection may have resulted in. The next one here is this red exclamation point. This is when there was an inspection and FDA mandated improvements because it determined that the facility was in an unacceptable state of compliance. So anything from this red exclamation point to the right will result in that red exclamation point in the header of the facility box that we show. The next one to the right here, this darker red exclamation point, this is when the FDA issues a warning letter, which is an official notification that the facility has significant violations of federal requirements. And then the furthest one on the right, this dark red X, an import alert. This means that drugs from this facility were banned from coming into the US. Sometimes all drugs from the facility, sometimes a few drugs will be allowed in. Debbie will talk a little bit more about that as well. Okay, next slide. Okay, so here's a timeline of a facility. So we can see here the last two inspections. There's a 2022 and a 2018. Both of these inspections resulted in the FDA determining that the facility was in an unacceptable state of compliance. And you can actually click on the view inspector notes here on these two, and that'll bring you to the actual document where the investigator, documents things that they observed. And Debbie will talk about the kinds of interesting stuff you can find in there. Next slide. Okay, and when there's a warning letter in a facility timeline, you'll see this. It says FDA issued a warning letter laying out significant issues, and you can actually click on the view warning letter and then go to the next slide. And here's an example one. We download them and archive them, and we put them on our site here. So anytime you see that, you'll be able to see, and then this will give you, a bunch of information about the types of deficiencies and the improvements that FDA would like to see. Okay, next slide. All right, when a facility was on the import bans list at the time of publication, we note this at the top of the facility page. So there's this red box here, it says facility under import ban. And that means that the last time that we checked the page, which was November 2025, last time we checked the import bans list, we found this facility on there. You can actually check yourself to see if the facility is still on there. So if it changed since we've updated the data, you can look, you can check that yourself. Debbie is going to show some stuff about what the FDA publishes around that. Okay, next slide. All right, and then talking about understanding a timeline generally about a facility and how the FDA operates. So here, there's a sequence of events starting at the bottom. There was an import ban in 2013. Then after that, in 2016, there was an inspection, and the facility, there were issues at the facility, but it was determined that they could fix them voluntarily. And then in 2017, this is the last time that we saw this facility on the import bans list. The FDA does not publish the date that they removed the facility from the list. They only publish the date when it was added. So we are able to kind of guess at when it was removed by looking at historical archives of this page, and we put the date here. So sometime after February 26, 2017, this facility was removed from the import bans list. And then you can see there's a 2018 inspection where FDA determined it was in an acceptable state of compliance. And that's it. That's it for me.
Thank you so much, Ruth and Brandon. For those listening in, I want to mention now, if you use the tool, you find something interesting about your generics, we're going to pop up a link on the screen here. You can use that. It's a form that you can fill out so that you can tell us more about what you found in the tool. And there's the link there. While that's up, I'm going to ask for our ProPublica reporters, Debbie Senza, Megan Rose, to join the conversation. Debbie, Megan, thank you so much for being here.
Hey there.
So I'm just going to start off by asking, Debbie, can you talk with us a little bit about how this RX Roulette series got started?
Yeah, thanks, Kevin, and hi, everyone. So many of us have heard stories about generic drugs that didn't appear to work like brand name drugs. Academic researchers have talked about it, lawmakers have talked about it, thousands of posts from consumers on social media about this. So Megan and I decided more than a year ago to spend some time investigating the FDA's oversight of the industry, particularly foreign drug makers. And the first thing we discovered was that there is a secret group, or was a secret group inside the FDA that was essentially cutting deals with substandard drug makers overseas by allowing them to continue sending generic drugs to the United States, even though their factories were officially banned from shipping drugs here because of safety and quality concerns. We found the names of these drugs on lists put out by the FDA, which we'll show you now, of foreign factories under import ban. Keep in mind that these are factories that had contaminated raw ingredients, metal shavings on drug making equipment, even bird droppings in sterile production areas, among many other problems. And scattered throughout these import alert lists were mentions of drugs that were excluded from import bans. And Megan and I really wanted to understand why and how this happened. And so, with Brandon's help, we found that these factories had shipped more than 150 drugs or their key ingredients to the United States while they were under import ban, and that the FDA hadn't regularly tested these drugs as they were coming into the United States. And so that first story, which has already prompted calls for reform by members of Congress, led to many others.
Thank you so much, Debbie. Megan, I wonder if you might jump in and just talk with us about why ProPublica wanted to make this app and provide this tool for people.
Yeah, of course. And hi, everyone. This was something that we really wanted to do from our earliest brainstorming sessions. It was really apparent early on how little information consumers had about their drugs. And we were rather astonished that you could find information about almost any other consumer good. Like you go on Amazon, you know where your belt is made, but this drug that you're going to ingest into your body, you don't get very much information about. And if you go on the FDA's website, it looks at first glance, there's actually a lot of information available. But we found very quickly that it wasn't very helpful because it would be a bit of information over here and a little bit over here, and they weren't connected in a way that allowed you to answer like the most simplest question about your drug. And we knew from looking on our own medicine labels that that information can often go nowhere, or sometimes would be downright deceiving. This was one thing we learned as we were reporting. As you pull up your medicine bottle, it might look like, oh, hey, it was made in the US, but it turns out that's just the company that literally put the label onto your bottle and put it in your bottle to go out to you. That wasn't the company that made it, even though it says manufacturer. And we knew if this frustrated us as journalists, we knew it would frustrate consumers. We wanted to give them a way to, empower them to find their own information and know where their drugs were made.
Yeah, and in fact, just to add on to what Megan said, we ourselves spent weeks trying to figure out where one of the most widely used generic in the United States, atorvastatin, which is used to control cholesterol levels, was made. And here we are more than a year into our project, savvy investigative journalists. And even with all of our resources, all of our documents, and all of our data, we ultimately hit a dead end. So this app became a top priority for us.
Yeah, thanks so much. I'm curious, you've spent all this time reporting. If this app existed back when you started this project, how would you have used it to aid in your reporting?
Yeah, like I said, our very first story focused on factories that were banned from the US market, but then given exemptions to continue sending certain drugs here. And we would have really liked to have known back then, especially for factories that we were focused most heavily on in our reporting, all of the drugs that they were making at the time, because that would have allowed us to provide to our readers a list of the drugs that were coming from those banned factories and that had come from those banned factories that that were arguably some of the worst plants that were making generics for the US. And we couldn't do that because the FDA doesn't publish a list of the drugs that are coming from factories. Drug makers generally don't disclose that kind of information. And so that leaves journalists and consumers in the dark. In fact, one of the things that we found most unsettling in our reporting is that the FDA publicly releases a number of their inspection reports. That's that 483 reference that Brandon mentioned earlier. The FDA calls its inspection reports 483s. And so they'll release 483s, but they will redact the names of the drugs that are mentioned on those 483s. So that means that we don't know which drugs had quality and safety problems. And that means that if there's an inviolable of injectable medication, say for cancer patients, that may be contaminated with glass particles, anyone reading an inspection report would have no way of knowing the names of that medication with the glass. With RX Inspector, we now at least know the most basic information, which is what drugs are coming from some of those most troubled factors.
To get into some more specifics into the weeds, and I think this will answer some of the audience questions they had about like what to do with information, or if they have noticed that their drugs don't work right, or they've had problems with them. There is an FDA database. It's called FAIRS, and it's where you can report what they call an adverse event. And so doctors can put these in, companies, consumers can let them know that like something's wrong with this drug. So that was, as for us, was a big resource to see what are people saying about their different drugs, what are problems that they are finding. And if we had had RX Inspector, it would have made it so much easier to connect those outcomes with where the drug was made. So we would have been able to look up these incidents in FAIRS, had checked out the patterns in adverse events, and then cross-reference them with the factory and known very easily, is this made at a factory that, has had bad inspections or hasn't ever been inspected? Because you will be surprised at how many factories have never been inspected by the FDA or haven't been inspected in years. And so that would have been one way that we have done it very specifically. Another is recalls. Like a very common thing that you look at with drugs is that those that have been recalled, and you could use RX Inspector to discover if there are any violations associated with the factory that made that recalled drug. It actually would have been a very quick way to expand on our reporting. And, also looking at a whole class of drugs that way. Because, for me as a consumer, when there's a recall about a drug that I take, even if it's not my specific generic drug manufacturer, I want to know, like, well, is mine okay? Should I be worried about mine? And as reporters, we wouldn't have been able to like very easily look across all the manufacturers who made those drugs, and see what was going on with their factories, and done a more broad, like wholesale story about what's happening with this particular drug. And then accountability too, of how long the FDA has been aware that there are problems there. Now there's a recall that's happening, and some of these recalls, are class 1, which means that they could cause really serious bodily harm to consumers.
I'm just gonna jump in here. I wanted to follow up on one thing you mentioned, which is, as a consumer, I look at a particular drug, I look at its facility. You mentioned, the FDA may not have inspected it in years. Can you give us? There was a question in the Q&A that was submitted. Just give us a sense of how common or how often the FDA goes to a factory, and what kind of is the normal cadence of that, and what's sort of, give us a sense of what maybe is a more alarming amount of time to see no inspections.
We noticed through our reporting that there could be years in between inspections, or there could be back-to-back inspections several years in a row. And what we were able to suss out is, one, the FDA uses a risk-based like algorithm essentially to decide where they're going to inspect, but they will tell the public almost no information about that. So it's really a black box how they decide to do their inspections. And then the inspections, how many years go between, we don't really know why, but 3 to 4 years is not an unusual amount of time to go without an inspection. And things that can impact it can be, is that factory or that drug maker trying to get approval for a new generic? And then the FDA might go back because they need to see if they should approve them. And so that might lead to more inspections. But where there's not a lot of like readily apparent rhyme and reason to when things are being inspected. So you might see in the app that, yeah, it's been several years, and I would say that's not unusual.
I would just add too, it's not the inspectors. It's not that the inspectors don't want to inspect. The inspectors want to inspect. They're essentially told by the FDA where and when to inspect. And so lawmakers and others and FDA inspectors have been asking for years to have increased resources and to ramp up oversight. And that has not always happened.
Yeah, it's been a problem that the GAO, the Government Accountability Office, has identified for a very, very long time, that the FDA does not have enough resources, enough inspectors to get everywhere that they need to get. And so inspection numbers are significantly lower than the number of actual factories that there are out there.
Yeah, I'll jump in to say this is something that Brandon, I believe, mentioned earlier. There are certain types of inspections that we don't have access to in the FDA's public dashboard. So there are, in some cases, instances when, as Megan just mentioned, before approval of a drug, the FDA will go in, but they do not publish the outcomes of those inspections, though that is something in time we'd love to get access to. Great. Megan, I'm going to turn back to you. You had just an incredible story around the time when we published the app. And I wonder if you might tell us about Hannah Getz, who was a 21-year-old. And, you should talk more about it. But I want to know about how you could have used RX Inspector in that reporting as well.
Yeah, so Hannah, she was back in 2019, a relatively healthy 17-year-old who was living with cystic fibrosis. And that's a disease that fills a lot of your organs with mucus. And so your lungs are really affected. But like I said, she was pretty healthy. And then she got sick, and very quickly pneumonia turned into needing a double lung transplant. And so she had this major surgery. She got donated lungs. She came through it. And one of the things that a transplant patient has to do for the rest of their life is to take a drug called tacrolimus. And it's a really critical drug because it basically prevents their body from rejecting their donated organs. So Hannah needed this drug to stay alive. And there are several generic makers of tacrolimus, and the FDA, there was known problems with some of them, and Hannah had the really unfortunate luck of being on two that were suspected to be bad generics that weren't working right. Her doctors didn't think they worked right. And Hannah at 21 started to reject her lungs, and she died. And it's a pretty tragic story. Her mom talked to me about, what it was like to go through this, and is always wondering, had she been on a different generic version of tacrolimus, would she still be here today? And so that's her mom, who's on the screen right now. That's Holly. That's her mom in her bedroom, a picture of Hannah. And this is Hannah when she turned 21, not too long before she died, about 6 months. Her health went real downhill at this point in time. And so it's a story that was about Hannah and about her journey, but was also about these generic drugs and what the FDA knew about them and when they took action. And I really focused in on Hannah, and I focused in on the FDA accountability of how they were approving these drugs. But another way into a type of story that's similar like that, in which RX Inspector would have been really helpful, is you could actually frame the story through the regulatory track records of the factories that made her tacrolimus. And you could also look at the other factories that made those drugs and what's going on kind of writ large with this the manufacturing of this generic drug, which happens to be one that's difficult to manufacture, and then of course is like really critical to life. And I think our ex-inspector would have been made life easy to do that kind of research and to look into it. Um, yeah.
Yeah, thank you so much for sharing about that. And the resources tab should have a link to that story. I really recommend people go and check it out in its totality. Okay, so now what I want to transition to is I want to help people make sense of some of the documents that they can find in this tool. So if we could bring up an example of one of those FDA inspection documents, those inspectors' notes that are in RX Inspector. Debbie, I wonder if you could talk us through like what we should be looking for in a document like this.
Yes, of course. So, at a high level, the FDA is responsible for inspecting factories that make drugs for the United States to see if those factories are making safe, high quality generic drugs. And so, this group of inspectors fan out across the United States and around the world to do this. And if they find anything concerning, they issue that 483 inspection report that we keep talking about. And that's what you're seeing. And these reports detail violations of what are known as good manufacturing practices, or GMP. And we read hundreds of these reports over the last year and saw the same kinds of breakdowns in factories again and again. And they're listed in order of violation on these 483 reports. And so what you'll see if you go through these reports commonly would be things like dirty drug making equipment. You'll see mentions of contamination or contaminated drugs. You'll see mold in sterile production areas. And what you'll see all too often are factory workers or employees or supervisors who manipulated or even destroyed drug testing records to cover up bad results. One report stuffed records in a trash. One report mentioned that a worker had stuffed records in a trash can and then poured acid on them. And so these are the kinds of things that inspectors find again and again. And as I mentioned, the findings are generally listed in the order of urgency. So the first one at the top of the report is usually the most serious. And companies have a chance to respond, right? They have a chance to push back. And then ultimately, the inspectors say or recommend voluntary fixes or mandatory fixes or no fixes at all. And then back at FDA headquarters in Maryland, agency officials can choose to listen to the inspectors or not, right? They can choose to downgrade the serious recommendations for official action to voluntary action, or they can choose perhaps to do more, to get tougher than what inspectors recommend. When the situation is particularly bad, the FDA will follow up with a warning letter. And that really puts companies on formal notice that they have to make changes. And if conditions don't improve, the agency can then ban a factory from shipping drugs here. We've talked about that, how they will ban a factory, which is really the greatest hammer the FDA has. And then, of course, they can also exempt certain drugs from those import bans, which we also spoke about earlier. And as the team already noted, you can see these inspection reports, the warning letters, and the import alerts in RX Inspector.
Thank you, Debbie. I know we have a lot of journalists on the call, and I wonder when a journalist comes here and gets some information, what are those next steps that they can take to pursue more information and context around what we're finding here?
Well, I think what you find, all those documents that Debbie just took us through, could really be a springboard into looking at a specific company. It could be a specific drug, and then how the FDA has handled actions with that company or around a class of drugs. I would recommend using it as a way to focus in on if you're looking at a specific company, for example, good FOIA communications between the company and the FDA. You could do that actually if you're looking at a specific drug. And there's also something called, they're known as CAPAs. They're investigative reports that companies must turn over to the FDA when they identify a problem with a drug. Those are FOIA-able. So you could really use this information RX inspector to kind of launch a bigger investigation. Also, like I talked about before, I think recalls would be a really fruitful area to use Arts Inspector to help expand your knowledge around recalls. FAIRS, which I mentioned earlier as well, the adverse event database. I think that kind of crosswalking I was talking about between outcomes and factories would be another great step that you could take after playing around with the app. I think searching for journal publications about problems with the types of drugs that you're finding at a troublesome factory is also another way to figure out if there have been medical community concerns about a class of generic drugs. A lot of times, like, I was talking about bits and pieces of information. Sometimes you'll notice that journal publications have been talking, like the medical community has been talking among itself about issues with the drug that might actually be related to manufacturing, and you would be able to make those connections by using RX Inspector. Another thing would be maybe pharmacy benefit managers. Like, they choose who to buy their drugs from and who to sell those from, and it would take a lot of digging, but you could perhaps connect those pharmacy benefit managers with a suspect drug maker that's had violations, regulatory actions, maybe an import alert, or warning letters, or just bad inspections after bad inspections. So I think there's a lot of places you could go with this once you are getting a sense of like what factories and drugs or companies that you want to look at.
That's great. There's just so much information in here. Um, I'm gonna pivot us now because I want to bring Brandon and Ruth back in and shift to questions that have been submitted from the audience for the remainder of the time we have. Um, so first, I'm going to share a link to our event survey on the screen. So that link is going to help us. It's going to help inform the content of our future events. And so if you would take a moment to fill that out, that would be great. So we received hundreds of questions through the RSVP form ahead of today's program. So I tried to distill them down and go with the ones that came up the most often. And the most common question we've heard about RX Inspector is this. Once I have this information, how do I use it? What options are there for me if I find something that concerns me about my generic and where it was made? So Megan, I wonder if you might jump in and talk a little bit through that.
Sure. I
Thanks.
think the very first thing to emphasize here is that you should not stop taking your drugs. This is just one piece of information among lots of information. You should consult with your doctor. So uh, definitely don't stop your medication regime based on what you see in Arts Inspector. We are journalists. We're not doctors. This is not providing medical advice. But if you can use this information to empower yourself, though, you can have an informed conversation with your doctor. Perhaps you've been having problems that you notice when your generic switch. So when I say like one data point, you could now know, okay, you'd be paying attention to what generic did I get when I filled up my prescription this month, because you might get a different one every month. And so now you might be able to say, okay, I'm going to track how I feel after I get this new maker of generic. And that would help you have a more informed conversation with your doctor. Also, something that Debbie and I learned a lot as we were reporting, is that a lot of people don't know that you get a certain generic version, a drug maker, based on your pharmacy. So whatever drug maker they bought is what your prescription will be filled with. So if you have concerns, one step that you could take is to call up a different pharmacy. Maybe you get your pills at CVS, and call up, the local grocery store and see what generic manufacturer they fill with. And then you could check it against the RX Inspector and see if you're comfortable with that factory. And then you're still taking your meds, but you're getting a different generic. And also, you could also try and switch to the brand name option, although this can be pretty cost prohibitive, and insurance companies are not likely to pay for that without a fight. Although if you've talked to your doctor, they can write on the prescription that it's to be filled only with brand, but whether that cost comes out of your pocket or not is really dependent on your insurance carrier.
Great. That's all super helpful guidance. Brandon, we got a number of questions about just, are we planning to update the tool, and how often will we update the information that's in here?
Yeah, the FDA regularly updates its inspections data. We do plan to update that Q1 of this year. They're constantly updating everything. So we are looking at trying to figure out how we can update everything, which would be all the labels data, all the facilities, everything. That's going to be a bit more of an involved process, but inspections, that kind of stuff will be updated more frequently.
That's great. Thank you. Debbie, I'll throw this one over to you. Someone asked, are any generics safe?
Yes. Yes, they are. And we hope that most, if not all of them, are safe. And we would point out, and we pointed out earlier, that finding issues in this tool does not necessarily mean that your drugs are bad. And I would also say that not all foreign factories are substandard, and not all US factories are good factories. But FDA inspectors and members of Congress and academic researchers at places like Stanford, Ohio State, University of Kentucky seem to be focusing mostly on the FDA's oversight of foreign drug makers, particularly factories in India, which make a number of our drugs, as well as factories in China, which produce many of the key ingredients that we use in our drugs. But the hope is that most of our generic drugs are safe.
As we've been talking about all of this, I wanted to bring up this other question that came in, which is just, is there any legislation that Congress is considering to fix this problem?
Yeah, I mean, leaders of the Senate Special Committee on Aging have been really interested in this issue, and they released a bipartisan report recently that calls on the FDA to alert drug purchasers like hospitals and government agencies when foreign factories under import ban are given a pass to send their drugs here, because in the past no one really knew it, not even Congress. And that's one of the things that Megan and I uncovered in our first story. The Senate committee also wants the FDA to do more drug testing, to do more drug testing. In fact, we recently reported that the agency doesn't routinely test generic drugs for quality and safety, including drugs that are coming from those banned factories. So that's been a concern.
Yeah, thank you. Brandon, I'm gonna go back to you now with this next one. What are the most important limitations of the tool that you should keep in mind when you're trying to wade through all this information?
Yeah, the main thing is the tool is, based on FDA public data, and the FDA releases like incomplete records a lot of time. So what you're going to see in RX Inspector is not a full history of everything that has happened with this facility. It is only a subset of what we have been able to gather from what has been published by the FDA. That's the main thing I think about. There's also limitations on how far back we can look. So if you're trying to look back far in time, we don't have warning letters past 2020, for example. There's a limit to like the 483s, the inspector observational notes. We just don't have completely comprehensive data. I think the last thing is like we try to match as many drugs to manufacturing facilities as possible, but there are holes. We do not match 100% of every drug that we know of. We are trying to do the best we can, but there will be cases where you'll find a drug that is your drug and we don't know where it's made. And part of that is because there's just no requirement for drug companies to state who and where the drug was made.
Yeah. Yeah, having gotten a behind the scenes look at this as we've been working on it, we just had to leapfrog from one database to the next, to the next, to the next to be able to put those pieces together. And if one piece was missing, that often meant we just didn't have the information to be able to connect all of the dots for you there. But often that was the FDA just didn't make that available. Okay, this next one's a two-parter. So first, How often does the FDA conduct inspections? Which we started to get into earlier, but I'll throw this one over to Debbie. And then second, just about talk a little bit more about testing and what we've learned on whether they're testing generics that are coming in.
Yeah. So inspectors are assigned inspections by leadership in at the FDA. They're told where to go and when to go, especially those who are doing foreign inspections because it takes a ton of planning to do foreign inspections. Imagine calling the government in China and saying, "We're coming to inspect one of your facilities," right? The State Department is involved. You have to deal with transportation, hotels, all kinds of logistics. So it's a grueling job, and inspections can take anywhere from a couple of days to a couple of weeks. Although inspectors say they often don't get a lot of time, and they wish that they had more time to inspect. And as Megan noted earlier, there are years can pass between inspections, and that has been something that members of Congress have been concerned about for years. Watchdog agencies have been concerned, and the FDA has faced this kind of criticism for not doing more inspections and also for announcing their inspections in advance, which can give drug companies time to clean up their act before inspectors show up. Now they're talking about doing more unannounced inspections, which is something inspectors have wanted to do for a long time. And in terms of your question on testing, Kevin, as we just mentioned, the FDA does not routinely test generic drugs once they're on the market. And Megan and I were really surprised by this. So were our editors and our whole team, especially because we know that there are some very troubled factories making generics for the United States. The Department of Defense was so concerned in recent years about the quality of drugs going to our service members that they are now independently testing about 40 generic drugs to be sure that they are working the same way as brand name drugs. And so, as part of our reporting at ProPublica, we solicited testing from the same independent lab, which tested several versions of 4 generic drugs, including 2 of the most widely used drugs in the US and including the tacrolimus medication that Hannah had used. That testing lab found irregularities with some of the pills, specifically in the way they were dissolving once they were ingested, which could leave consumers without the right therapeutic levels for treatment. So our testing turned up some pretty alarming findings for some versions of generic drugs.
Thank you. I'm going to pivot over to Brandon. I think we have time to quickly go through this. Wondering, how do I find out more about a particular facility? Let's say I'm particularly interested in the facility that's down the street from me.
Right. So yeah, there's a couple of cases where that could come up. One, you already know about the facility, right? It's a facility of interest. Or two, you have a drug and we didn't link it, but you have some more information. So maybe the pill bottle will sometimes say like where it was made, but we haven't linked it for whatever reason. I'm just going to pull up the screen real quick. Here's an example of a drug where we couldn't find where this one was. We couldn't link this one automatically inside of our app. But when we look up the label, we've extracted this kind of information from the label, and that looks like this on the label itself. So it says manufactured by Apotex. So in addition to like the drug search that Ruth showed, we also have a facility search. So that's in our advanced search, which you can get to from the homepage, and this second search here. So I'm going to type in Apotex. I'm going to do a search here. We get 5 results. So you can see all of the facilities that are in our application here that are, yes, you can search them here. And then if we want to know a specific one, in this case, we actually have a Canadian postal code. So I'm just going to Control F search here, and we got to this facility. So you can search for like more specific names. You can pull up specific facilities by using our advanced search. And that's really the purpose of this here.
Great. Thanks for walking us through that. Ruth, talk to me about what's included in the database and what's not included. So, is it just pills or is there more than that?
Yeah, so I mean, the short answer is yes, there's more than just pills. So it's all generics, but then I'm going to walk that back immediately. We did remove a few subsets of items. I think we moved gases like oxygen tanks, allergy testing kits, some drug kits. And then I think the only other thing to note maybe is that we did include authorized generics, which are technically brand name drugs, but they are labeled with the generic name. They sort of present as generics. And so we included those in the app as well because we thought that maybe users, consumers wouldn't know that they had a brand name drug despite it being one. So those are in the app as well. But yeah, we have way more than pills. We have injections, creams, insulin, all sorts of stuff.
Yeah, this particular person wanted to know if it included toothpaste. And the answer is yes, it does, if it's a prescription generic, which some are. Okay, and then I want to talk about let's say I'm using the app, but I'm still having trouble actually locating my drug. Is there any more troubleshooting that we can do, or let's talk through some of the common issues with that, Ruth?
Yeah, so I'm going to try to share my screen again real quick because it might be easier this way. So there's a few, and a lot of them come from differences between what is on the label or what information you have versus what we have in the app. So for instance, maybe this is just a random drug and company that I pulled out from our records, but say this is what is on my label and I search, I'm getting no results. So if I remove this, I might see that there are ones manufactured by Teva, but they actually don't have that USA at the end. So there's a lot of examples like this where just small differences can really trip you up. So I would say, if you're entering a drug or a company name that has extra information at the end, like the word company or incorporated or USA, or a drug name that has like some dosage stuff at the end, try getting rid of that. That can really widen your search results. The other thing that can be tricky is dosage. Dosage is displayed differently, really, depending on the drug. So if y'all can see this is, I think, like an antifungal cream. It appears in shampoos and things like that. And its dosage displays often in percents. So we've tried to match what you will see on your label, but this can appear in lots of different ways. So this is all percents, and I should have pulled up one, but there could be one of these that says like 100 milligrams per milliliter or something like that. So when in doubt, dose can be a really, really helpful way to narrow your results. But if you're not seeing what you expect, kind of back up, see if there's other forms of the dose listed on your label, and see if there's other ways that might be displayed, and that can really help get you more results as well. Another thing to note, oh, sorry.
I was gonna say, I've got a lot of questions like this from people, and I would just say, if you cannot find your drug, talk to your pharmacist. Your pharmacist can pull additional information. They can get that NDC, the National Drug Code. They can tell you exactly who the manufacturer is, and they can actually help you find the exact drug.
Yep. I think that was the last point, so what Brandon said. And I guess the only other thing I'd say is that we are actively making improvements to search. So if something's bothering you, hopefully we'll fix it. We're working on getting dosage to match better and lots of other things.
Great. Thank you so much. So, all right. That is going to be all the time that we have today. I want to thank Brandon and Ruth for their important work on this app, Debbie and Megan for shedding some light on how reporters might use it. For the journalists on the call, we'd love to know about any stories you publish using information in this database. You can email us those links at fda@propublica.org. Again, this event has been recorded, so you'll receive an email with the full video of today's discussion. We hold these virtual conversations every month. And if you haven't yet, please be sure to sign up for our events newsletter so you never miss any of those. We'll share the link to that newsletter in the follow-up email, along with a list of relevant resources. So from all of us here at ProPublica, thank you so much for joining us, and have a great evening. We'll look forward to seeing you next time.